viewers, welcome to a bright new session. So today's topic is about which is the best test for diabetes. Diabetes is one of the most prevalent diseases worldwide. According to the International Diabetes Federation, around 537 million adults are living with diabetes. This accounts to 1 in 10 adults globally. Countries with the highest number of diabetics include China, India and the United States. Estimated cases in India, according to the 2021 estimate, is around 8 to 9% of the adult population. Moving on to the types of diabetes. As most of us know, we have the main types, that is type 1, type 2. There are other specific types and hybrid types. In type 2 is the most common type of diabetes we see across the world. It is seen mostly in the adult and elderly population. Type 2 constitutes for 90 to 95% of the cases of diabetes, whereas type 1 for 5 to 10% of the total diabetic cases and is seen in children and young adults. Speaking about the causes of diabetes, the primary causes of type 2 diabetes are obesity and sedentary lifestyle, whereas for type 1 the main cause is the genetic predisposition. An article released by the WHO in 2019, the main tests which are done to diagnose diabetes, we have 4 main tests. One is the fasting plasma glucose. The second is 2-hour plasma glucose after OGTT, that is oral glucose tolerance test. And the third test is the HbA1c test. The fourth test is the random plasma glucose test. According to the American Diabetes Association, a diagnosis of diabetes is made when the fasting plasma glucose is more than 126 mg per deciliter, when the 2-hour plasma glucose after OGTT is more than 200 mg per deciliter, when the HbA1c is more than 6.5%, or the random plasma glucose is more than 200 mg per deciliter in a patient who has signs and symptoms of diabetes. So this is how the diabetes is diagnosed. So the main star of today's topic is the HbA1c test. So why is HbA1c test important? HbA1c test is also called the glycated hemoglobin. Hb, as you know, is hemoglobin. So hemoglobin is a protein found within the RBCs. When glucose circulates in the blood, some part of this glucose binds to the hemoglobin and forms glycated hemoglobin. The higher the blood sugar level, the more glucose binds to the hemoglobin. So the normal range of HbA1c or the glycated hemoglobin is 5.7%. A level of more than 6.5% is considered diabetes. The range in between 5.7 to 6.4 is considered the pre-diabetic range. So why is HbA1c test important? Because HbA1c test does not need fasting, and it is an indicator of average blood glucose over a period of the past 2 to 3 months. Tests like fasting plasma glucose and random plasma glucose indicate the current level of glucose in the body, whereas HbA1c test is an indicator of the average blood glucose over a period of the past 2 to 3 months. This is because the lifespan of RBC is 2 to 3 months. So HbA1c test is not only used to diagnose diabetes but also to monitor diabetes in a patient on treatment. So the goal is to maintain HbA1c less than 7% in diabetes. So today's session was all about the prevalence of diabetes, the types of diabetes, the tests used for diabetes, how HbA1c is a better test compared to the other tests for diabetes. With that, we conclude this session today. If you found the video useful, do subscribe to this channel, Health Lab with Dr. Sreeja. Thank you.